Welcome back to Sunrise to Hot Topics now. And working Australians are paying more out of pocket for medical bills and even delaying seeing the doctor due to high costs. New data analysis shows that while children and older Australians were better off in 2024 because of the government's record levels of funding into Medicare, people aged between 16 and 64 have just not reaped the benefits. It comes as Medicare shapes up to be a point of fierce debate leading up to the federal election, as it always is. Let's bring in Deputy Opposition Leader Sussan Ley and 7 News reporter Cassie Zervos. Morning to you both. Sussan, that 2023 budget policy tripled the bonus paid to doctors. We saw 5 million extra free GP visits for children and concession card holders, pensioners, but more clearly needs to be done. What's your plan?
Well, Eddie, the issue here is that bulk billing is going down. It's gone backwards by 11%. It's more and more expensive to see a doctor. Everyone knows that. You talk to mums who might have 3 children with a respiratory tract infection in 1 week, and they're thinking, can I afford that third doctor visit? And it's just not good enough. The answer, firstly, is to bring down the cost of living, because doctors, medical practices are small businesses. So they're faced with the increases that every Australian is faced with, whether it be power prices or just running your business and the cost of consumables, getting things in the door. You do all that, and as a GP and a medical practice, you just can't find a way to actually bring down the cost for your patients, even though GPs are all doing their best, and we know that GPs are the centre of your care.
So, I mean, we're talking about that bonus being tripled to doctors. So the government is contributing. They have made changes there. But as you say, those costs keep on going up. Will you consider expanding this bonus to all age groups? Can we even afford to do that?
We'll look at health policy broadly. I served as health minister for a few years, and it isn't just about one particular area, it's about looking at the whole system and the whole picture. But what I'm seeing now is small businesses under pressure, and that pressure has to be relieved first and foremost. And it's not just, of course, medical practice, it's every single small business. So we have to get that right, because we know that doctors are incredibly important. And Eddie, when you shared your own health diagnosis and you inspired hundreds of thousands of Australian women to go and get their checks, that was critically important. And I worry about that, because I want particularly women who put their own health last to make sure that they do look after themselves. And if the cost of going to a doctor is preventing you walking through those clinic doors, that's just not good enough.
Yeah, and often people, particularly mums, do put themselves last when it comes to seeing a doctor, Cassie. And more than half of the people who see a doctor are the ones who are getting stung by the rising costs. It does, as Sussan said, it makes you stop and think, am I that sick? Do I need to go? Do I have the cash right now while I'm waiting for the rebate to come back to even see a doctor?
Oh, absolutely, Eddie. And I mean, I can give you an example of that. Last week, I visited a new GP and I was charged $150 for a new patient's fee. I got about $30 or $40 back. So I can completely understand why people are putting off those appointments. And in terms of bulk billing, I mean, it is so hard to get into those doctor's appointments. Normally it's 4 or 5 weeks down the track on a random Monday or Tuesday at 2:20 in the afternoon. And I mean, who can make that appointment? So if you're thinking about people in their early 20s and weighing up, do I spend $100 on a doctor's visit? Where do I really need to go? Am I that sick? Do I really need that prescription? And it was only a couple of years ago where we actually had to go to the GP to get the pill prescription. So I'm not sure if it's one of those things where we start using more student doctors to alleviate that stress, which could help as well for things like scripts. But in terms of the cost, I mean, it is so expensive to go, and often doctors are watching the clock. I was only in there for like 25 minutes for my appointment last week, and it was just for a referral. So when you're adding up that on top of Christmas, New Year's period, it is a lot of money to be spending in 20 minutes, and you're not getting that much back at all.
Yeah, and they obviously just charge you $50 extra just to put your details into the computer, I think. Moving on, billionaire Clive Palmer has recently applied to register the trademarks teal and also the Clive and Pauline Party. When asked for a please explain, a spokesperson for Palmer declined to comment. A spokesperson for Pauline Hanson, however, disputed suggestions the pair would merge. Sussan, a nice couple, a good pairing in Parliament, do you think?
Well, I feel a bit sorry for the Teals. They've spent the last 4 years telling everyone they're not a political party, and don't call us that. We're a series of independents making independent decisions, but now they're fighting the trademarking of the term teal as a political party. So we've got one billionaire, Clive Palmer, building the trademarking of the teal brand, another billionaire, Holmes Court, actually trying to create more teals. So it is a little bit crazy. We want to keep big money out of Australian politics. That's what happens in the US. We don't want to see that here.
Interesting to see how that pans out, that partnership between Clive and Pauline, if it is indeed going to happen. Hey, Cassie, I want to get you on this one. Do we need to see the end of Aussies beeping their horn while on the road? Are you a beeper?
Oh, Eddie, I am a beeper, but I do have a rule. I count to 10 seconds in my head. And when I get to 10, I just do a little polite beep beep just to get the show on the road. I think that is incredibly important. I don't mind the idea of a fine, but for me, the biggest pet peeve on the road is when you give way to someone, you make eye contact with them, and they don't give you a thank you wave. For me, that really breaks my heart, because I think that is the biggest polite policy on the road. So I'm all for the beep, but I do think you can be polite about it. Just a little toot toot.
Yeah, I instantly pass judgments on the people who don't wave. What do you reckon, Susan? Are you a beeper or not a beeper? We're talking about driving, not politics here.
I'm out here in rural Australia and I beep at the wildlife on our roads occasionally. It's a good reminder, everybody, please don't lose your cool on the roads. Never do that, and be patient. There are drivers who aren't as used to the roads as you are, and please be safe this holiday period.
Susan, you'd be the sort of one finger lift. You've got to do that in the regions, don't you? Thanks. Thank you, Susan.
Yes, that's definitely that.
Thank you, Cassie.